Hello, everyone. Our theory is Pender and colleagues health promotion model, and we are Desi Amigos. Our names are Jasminder, Servier, Yvette G, Yvette J, Leslie, Andrew, Maria, Manvi, Yuvraj, and Nadarsh. To start, we will do a brief background of the theorist Nola J. Pender. Pender was born on August 16, 1941, in Lansing, Michigan. She is now 82 years old. Her interest in nursing began at the very young age of 7, in which she experienced her aunt being hospitalized. Her witnessing care given by the nurses to her aunt was what inspired her curiosity in nursing. She also attended Michigan State University, where she received both her bachelor's in 1964 and master's degree in nursing in 1965. She also attended Northwestern University, where she received her PhD in Psych and Education in 1969. During her doctoral studies, Pender became interested in health promotion. Pender has been a nurse educator for over 40 years at Michigan State University, where she has taught baccalaureate, master's, and PhD students.
Okay, so going over a bit of what Pender has accomplished in her career. So she has written and published numerous articles, many of which are related to exercise behavior and relaxation training. So Pender has served as a member of numerous organizations, and she also co-founded the Midwest Nursing Research Society in 1975. And this organization focuses on generating knowledge and translating research evidence into the nursing practice. Also, during the mid-1970s, she began studying health promotion behaviors, which led to her developing the health promotion model in 1982, which we are discussing today. From this, she developed the Girls on the Move program, which studied the use of the health promotion model in helping the youth have physically active lifestyles. And last but not least, Pender was designated a living legend of the American Academy of Nursing in 2012. And this award is only given to specific nurses who have made an outstanding contribution to the nursing profession.
Okay, so now that we know a little bit about Pender, we're going to be talking about what her health promotion model is. So her health promotion model basically focuses on increasing the patient's well-being, and by doing this, it focuses on 3 different areas. So the first area is the individual characteristics and experience. The second one is the behavior-specific knowledge and effect, and the third one is behavioral outcomes. And these 3 areas help us understand the determinants of health. Another important point of her model is that it doesn't define health as an absence of disease, but rather a positive dynamic state. So instead of focusing on providing more treatment, this model focuses on more time on addressing health promotion and illness prevention. And by doing this, it helps nurses to positively impact patients to health promoting behaviors. And these behaviors can help result in improved health, enhanced functional ability, and a better quality of developmental stages. Now, going more in depth into the 3 categories within the model, we're going to start off with individual characteristics and experiences, and this involves personal biological factors such as gender, age, agility, and strength, and then it also involves personal psychological factors such as self-motivation, self-esteem, and then how the person themselves perceive their health status. Then it also involves personal social cultural factors. This includes race, ethnicity, and then education. Moving on to behavior-specific cognitions and effects, we have perceived benefits of action, and these are the positive actions we're expecting to receive as an outcome from the behavior. And then the perceived barriers to action, these are the obstacles we assume that we're going to have. And then we also have perceived self-efficacy, and this is like the capability of a person to organize and execute their behavior. It is important to note that the perceived self-efficiency influences the barriers of action. So if a person is more efficient, the likelihood of them having more obstacles will decrease. And then activity-related effect, this is like the subjective feelings the person will experience based on the behavior. The activity-related effect will influence the perceived efficiency. For example, if a person is having more positive feelings from the behavior they're doing, their efficiency is more likely to increase, increasing the better outcomes of the behavior. And then we also have interpersonal influences, and this is the beliefs and attitudes towards the behavior. This could be influenced by the person's norms or the surrounding people in their life. And then we have situational influences. This is the perception of the situation or the context impacts, how the context impacts the execution or the behavior. And then the last category is behavior outcomes, and this is the starting off with the commitment to plan of action. This would include the patient and the nurse identifying and creating a plan of strategy for the behavior they want. And then we have immediate competing demands and preferences. So for this, competing demands is behaviors or there are environmental factors that we cannot control. So if a person is working or they have to take care of a family, those are responsibilities they have and that are out of their control, compared to competing preferences, which are behaviors with high control. For example, if we're trying to help a person with obesity to improve their diet and having them pick an apple over an ice cream, that would be competing preference. And then finally, the health promoting behavior, and this is the action outcome that we are aiming to obtain with the behavior. And then here is a visual of what the actual model would look like. If you can look at the picture, you can see the 3 different categories.
And this is a research article that applies this theory. And the title of this research article is The Effect of Exercise Training Based on the Health Promotion Model on Menopausal Symptoms. And the study was conducted in 2022, and the purpose was basically how to investigate exercise training, and it was guided by the health promotion model. Basically, they wanted to see how exercise training affects women with menopausal symptoms. So one way to do that was by carrying out a controlled and research group experimental study. So a total of 156 women participated in the study, and pretty much the study followed a 30-minute daily exercise routine for 12 weeks, and then the control group received neither the training nor engaged in any exercise. And pretty much what they determined was that the health promotion model conducted alongside exercise helps alleviate the menopausal symptoms, and it pretty much emphasized the importance of exercise on women that are going through menopausal symptoms.
And to further relate the article to the Pender's theory, the willingness to take action for their health to decrease these symptoms of the menopausal symptoms, that just shows that they are taking action in their own health, and as well as the perceived benefit of action with the expected outcomes, as well as developing a plan of committed action that they're going to stick to. And as Adarsh stated, they have a set workout regimen where they stretch and they do walking. And this also is going to relate to the health model theory by their perceived self-efficacy. Their goal, their outcome being related to this model. They're all going to strive to get that achieved benefit towards the end of the experiment. So, yeah.
So I'll be talking about how to apply the theory in clinical practice. This model is one of the most widely used models in the clinical setting. It can be used to change unhealthy behaviors and to promote health by increasing the patient's well-being. Identifying factors related to pursuing the health promotion model is important, as this is the first step taken in order to improve the behavior. Participation in the model is influenced by experience, family, society, culture, and it is important to get this background information in order to find the best way to move forward. We need to also talk about motivational factors. Some motivational factors include perceived health benefits. These include positive effects on physical, mental, and spiritual well-being. It is also important to overcome perceived barriers that the patient may have in order for the health model to be the most effective. Educating the patient as to why they should change the behaviors into more positive ones is important as well. You should let them know that being involved in health promoting activities can have a positive impact on your health and as your life as a whole. While you're carrying out the actions to improve the behaviors, it is important to be supportive while they implement the change. This can result in positive reinforcement, and it will be more likely for them to keep that behavior going.
So expanding on what Jaspinder just talked about, I will be talking about a made-up scenario. So this patient's name is John. They have obesity, and the nursing theory application that we would apply is diet and exercise. Some factors that could contribute to John's obesity is stress or environment, or maybe they just can't afford good food. And it's important to reduce their weight because it can cause other health problems like heart problems, high blood pressure, or diabetes. And it's important that we talk to them about getting like a nutritionalist, or getting them in the gym, or maybe even just starting out small with like tracking their steps daily. Just small changes like that can help significantly improve their mental and physical and emotional well-being, like Jaspinder stated in his slide. And we would also have them come in often so we can track their progress and provide positive feedback to keep them going on the right path.
So this is the engagement portion of the presentation. So during this, feel free to pause whenever, so you can take your time and get the right question, right answer. And so for this part here, it's Dora theme. So you got to find the right answer before a swiper steals the answer from you. So for question 1, in what year did Nola Pender develop the health promotion model? And the answers are A, 1942, B, 2007, C, 1999, and D, 1982. And the answer for this question is D, 1982. And for the second question is blue clues. So if you paid attention, you should have a clue on what the answer is. So for question number 2, what are the different areas that Pender's model focuses on to increase a patient's well-being? So the answers are A, individual characteristics and experience, B, behavior-specific cognitions and effect, C, behavioral outcomes, D, all of the above, and then the correct answer is D, all of the above.
I continue with the audience engagement portion of the presentation. Question number 3 is, what does Pender's model define as health? A, an absence of disease, B, a positive dynamic state, C, optimal functioning of the body, or D, being at a positive mental state. And the answer for this question is B, a positive dynamic state. And for the last question of the audience engagement quiz is, what is one of the behavioral outcomes for Pender's model? A, eventual competing of demands and preferences, B, decline in health promotion, C, delay to plan of action, or D, health promoting behavior. And the answer to this one is D. And you guys can use these questions to help guide your guys' discussion replies.
So these are our references.